Hi, welcome to Inpatient Rehabilitation Facility Basics, performing a comprehensive pre-admission screening to help you choose the right patient. Have you ever wondered what types of patients you should be admitting to the Inpatient Rehabilitation Facility, or IRF? It is important to choose the correct type of patients for your inpatient rehabilitation facility to prevent denial of claims, receive timely and proper payment, and ensure optimal care for the beneficiary. It is important to remember that your IRF documentation should show that there is a need for intensive rehabilitation therapy and the inpatient rehabilitation facility admission is reasonable and necessary. Performing a comprehensive pre-admission screening will help your inpatient rehabilitation facility determine the correct patient. The comprehensive pre-admission screening is one of the components Medicare requires for all IRF admissions and stays. The pre-admission screening serves as the primary documentation by the IRF clinical staff of the patient's status prior to admission. It should demonstrate the specific reasons that led the IRF clinical staff to conclude that the IRF admission would be reasonable and necessary. Inpatient rehabilitation facilities must make this documentation detailed and comprehensive. So let's take a look at some of the requirements of a comprehensive pre-admission screening. The comprehensive pre-admission screening needs to be completed within 48 hours prior to the IRF admission. This allows the rehabilitation physician and the facility to get a better picture of the potential patient and facilitate the decision-making process for admission. If the pre-admission screening is performed more than 48 hours prior to admission, it will be accepted as long as an update is performed either in person or by telephone to document in the patient's medical record the patient's medical and functional status within 48 hours prior to the inpatient rehabilitation facility admission. The pre-admission screening should consist of a detailed and comprehensive review of each of the patient's conditions and medical history. It needs to be performed by a licensed or certified clinician appointed by a rehabilitation physician. The rehabilitation physician may designate a qualified licensed or certified clinician to conduct the pre-admission screening. A qualified licensed or certified clinician is considered as a person that is appropriately trained and qualified to assess the patient's medical and functional status, assess the risk for clinical and rehabilitation complications, and assess other aspects of the patient's condition both medically and functionally. It is the responsibility of the IRF and the rehabilitation physician to determine and make sure that these designated individuals have the necessary training and qualifications. A comprehensive pre-admission screening needs to be performed either in person or through a review of the patient's referring hospital medical records when the hospital stay precedes the IRF admission. Documentation on the comprehensive pre-admission screening must indicate the patient's prior functional level before the event or condition that caused the need for intensive rehabilitation therapy, the patient's expected level of improvement, an evaluation of the patient's risk for clinical complications, the expected length of time necessary to achieve that level of improvement, and the name of the professional performing the pre-admission screening. The pre-admission screening should provide an accurate assessment of the patient's ability and willingness to actively participate in intensive rehabilitation at the start of care. Intensive rehabilitation can be supported in therapy up to 3 hours a day for 5 days a week or less intensive over 7 days a week. Documentation must support why care from a lower level of care, such as a skilled nursing facility or home health, is inadequate or inappropriate for the patient's clinical situation. The pre-admission screening should reflect an intensive and coordinated interdisciplinary rehabilitation approach to facilitate frequent, structured, and documented communication among disciplines to establish, prioritize, and achieve treatment goals. Avoid using vague or subjective descriptions when documenting the patient's needs. The comprehensive pre-admission screening must contain the signature of the rehabilitation physician along with the date and time of the pre-admission screening. The documentation should show that the admission decision was made prior to the patient's admission and confers with the rehabilitation physician's decision. It is the IRF's responsibility to ensure that the admission decision is documented in the patient's record. In order for the inpatient rehabilitation facility stay to be considered reasonable and necessary, documentation needs to demonstrate a reasonable expectation of the need for complexity of the patient's nursing services, close physician medical management, interdisciplinary team approach for rehabilitation, intensity of services needed, and therapy services. I hope you found this video on performing a comprehensive pre-admission screening to help you choose the right patient helpful. If you did, please like it, share it, and subscribe to our YouTube channel. We value your opinion. Please take our survey. You can click on the QR code or scan it with your smart device. Tell us what you liked about it and what educational topics you would like to see us cover in the future. Thank you and have a wonderful day.